On a Tuesday morning in September 2019, Margaret Chin received a phone call that would unravel one of the most devastating betrayals in her hospital's 127-year history. The voice on the other end belonged to their largest medical equipment supplier, demanding payment on a six-figure invoice that, according to their records, had already been settled months earlier. Margaret had dedicated 32 years of her life to St. Catherine's Children's Hospital in Portland, Oregon, rising from a junior accountant to chief financial officer. The institution served over 15,000 young patients annually, many from families who couldn't afford treatment elsewhere. St. Catherine's operated on razor-thin margins, sustained by community donations and the unwavering dedication of staff who often worked for below-market salaries, driven by their mission rather than profit. The hospital's finance department was small but trusted. David Kowalski had joined as assistant controller 3 years prior, bringing impressive credentials from a prestigious accounting firm. At 41, he was methodical, quiet, and seemingly devoted to the hospital's cause. He volunteered for overtime, rarely took vacation days, and had even organized fundraising drives for the pediatric cancer ward. Colleagues respected his attention to detail and his apparent commitment to stretching every donated dollar as far as possible. David lived modestly in a suburban ranch house with his wife Sarah and their 2 teenage children. To neighbors and coworkers, he embodied middle-class stability, coaching Little League on weekends, driving a 5-year-old Honda, shopping at discount stores. Nothing about his lifestyle suggested the financial pressures that had been mounting since his father's extended battle with Alzheimer's disease, which had drained the family's savings despite insurance coverage. What Margaret discovered that September morning was the tip of an iceberg that had been growing for 18 months. David had developed an elegant but devastating scheme that exploited the trust placed in him and the hospital's lean oversight structure. His method was sophisticatedly simple. He would duplicate legitimate invoices from medical suppliers, creating false billing records in the hospital's accounting system, then redirect those payments to shell companies he had established. The process began with David intercepting incoming invoices before they reached other staff members. He would scan these documents, alter the banking details and company names slightly, changing MedSupply Solutions Incorporated to MedSupply Solutions LLC, and create entirely new vendor profiles in their system. When a legitimate invoice came due, David would flag it as already paid in their records, while simultaneously processing payment to his fraudulent duplicate. To cover his tracks, David volunteered to handle vendor communications, telling colleagues he was streamlining their supplier relationships. When legitimate vendors called about overdue payments, David intercepted these calls, promising quick resolution while stalling for time. He forged reconciliation documents and created false correspondence that satisfied the hospital's monthly audit requirements. The money flowed into 3 different shell companies David had registered in Nevada and Delaware, using virtual office addresses and nominee services to obscure his ownership. From there, funds were transferred through a complex web of business accounts before ultimately reaching personal accounts he controlled. David used this money to cover his father's care costs, pay down mounting credit card debt, and gradually improve his family's lifestyle in ways that wouldn't attract attention. Private tutoring for his children, better health insurance, small home improvements. Over 18 months, David stole $847,000 from St. Catherine's Children's Hospital, money that should have funded life-saving equipment, medications, and treatments for vulnerable young patients. The unraveling began with Margaret's confusion over that supplier's call, but the real breakthrough came from an unexpected source. Jessica Torres, a new accounts payable clerk hired just 2 months earlier, had noticed discrepancies while organizing filing systems. Coming from a larger hospital with more rigid procedures, Jessica found it odd that so many vendor communications went exclusively through David, and that certain suppliers seemed to have multiple company names with similar services. Jessica's concerns initially seemed minor, questions about filing protocols and duplicate vendor numbers. However, when she mentioned these observations to Margaret during a routine check-in meeting, something clicked. Margaret remembered the strange phone call from their equipment supplier and began pulling records. What she found was troubling. Multiple vendors with nearly identical names, banking information that didn't match corporate addresses, and communication patterns that all flowed through David. Rather than confronting David immediately, Margaret quietly contacted 3 of their largest suppliers directly. Each conversation revealed the same disturbing pattern. Legitimate invoices marked as paid in St. Catherine's system were showing as overdue in the vendor's records. The hospital had been paying someone, but not the companies that had actually provided services. Margaret immediately contacted the hospital's board of directors and their external legal counsel. Within 48 hours, they had engaged a forensic accounting firm and notified law enforcement. The Portland Police Department's Financial Crimes Unit, led by Detective Amanda Foster, began working alongside FBI agents specializing in healthcare fraud. The investigation required delicate coordination. David couldn't be alerted to their suspicions while evidence was being gathered, so he continued working normally for 3 weeks while investigators built their case. Forensic accountants traced the shell companies back to David through corporate filings and bank records, while detectives conducted surveillance and gathered evidence of his financial activities. The breakthrough came when investigators obtained warrants for David's banking records. The trail of money was clear and damning. Hospital funds flowing into shell companies, then being transferred to accounts David controlled. Digital forensics experts analyzed the hospital's computer systems, finding evidence that David had created and modified vendor records, sometimes accessing the system from his home computer during off hours. Meanwhile, investigators expanded their scope, discovering that David's scheme had grown increasingly bold over time. Early thefts were small and infrequent, but as his confidence grew and his father's medical bills mounted, the frequency and amounts increased dramatically. In the final 6 months alone, he had stolen over $340,000. The investigation also revealed how David had exploited the hospital's culture of trust and their lean staffing model. In a larger organization with more oversight, his scheme would have been detected within weeks. But at St. Catherine's, where everyone wore multiple hats and processes were streamlined to minimize administrative costs, David's careful manipulation of records and vendor communications had gone unnoticed. Detective Foster worked closely with federal prosecutors to ensure their case was airtight. They needed to prove not just the theft itself, but David's intent to defraud and the specific methods he used to conceal his crimes. David was arrested at his home on a Thursday morning in November 2019. According to Detective Foster's report, he initially appeared confused, then resigned as the charges were explained. He was booked on multiple felonies: aggravated theft, computer fraud, money laundering, and healthcare fraud, charges that carried potential sentences totaling over 20 years in prison. The trial, held 8 months later due to COVID-related delays, painted a devastating picture of betrayal. Prosecutors methodically presented evidence of David's scheme, using bank records, computer forensics, and testimony from hospital staff and vendors. Margaret Chin's testimony was particularly powerful as she described the impact on the hospital's operations and their mission to serve vulnerable children. David's defense attorney argued that his actions, while inexcusable, were driven by desperation over his father's medical bills and that he had intended to repay the money. However, prosecutors demonstrated that David had made no attempts at repayment and had instead increased the frequency of his thefts over time. The trial's most emotional moment came when Dr. Rachel Martinez, head of the pediatric oncology ward, testified about equipment purchases that had been delayed due to budget constraints, delays that coincided with David's thefts. She described having to tell families that certain treatments would be postponed, not knowing that money designated for patient care had been stolen. David's wife, Sarah, testified that she had been unaware of his crimes, believing his explanations about insurance reimbursements and family inheritance for their improved financial situation. In February 2021, David Kowalski was sentenced to 8 years in federal prison, followed by 3 years of supervised release. Judge Patricia Hammond called his crimes a profound violation of trust that directly impacted vulnerable children and their families. David was also ordered to pay $847,000 in restitution to St. Catherine's Children's Hospital, though investigators had recovered only $180,000 from his accounts. The sentencing brought mixed emotions from Margaret Chun and her colleagues. Justice had been served, but the damage to their institution was lasting. The stolen money had forced budget cuts, delayed equipment purchases, and created financial stress that affected patient care. Sarah Kowalski filed for divorce during the trial, seeking to protect herself and her children from the financial consequences of her husband's crimes. David is currently serving his sentence at a federal correctional institution in California, with a projected release date in 2027. His case prompted St. Catherine's to implement new financial controls and oversight procedures, changes that were painful reminders of how one person's betrayal had shaken an institution built on trust and service. The Kowalski case serves as a stark reminder that financial crimes aren't victimless. They have real consequences for real people, especially when they target institutions dedicated to helping others. Trust, once broken, requires years to rebuild, and the children who needed care during those 18 months of theft paid the ultimate price. Don't forget to hit subscribe.